Today we're going to go over heat-related emergencies, cold-related emergencies, and poison emergencies. So starting off with heat-related emergencies. So most heat-related emergencies are caused by vigorous exercises, and we're going to start off with heat cramps, which are painful muscle spasms, and they're most often found in the calves, arms, and stomach muscles and the back. So what are the signs of heat cramps? These include muscle cramps, sweating, and a headache. So what should you do to treat heat cramps? So first of all, always make sure the scene is safe, wear PPE, have the person with heat cramps to rest and cool off, and give them something to drink that contains sugar and electrolytes, such as a juice or a sports drink, or water if nothing else is available. And once these symptoms stop, the person can continue exercising again, but stretching, icing, and massaging painful muscles may also be helpful. So a bag with ice and water and wrapped in a towel may be applied to the sore muscle for up to 20 minutes if the person can tolerate it. So here's what you need to know for heat cramps. Mild heat-related emergencies is a warning that the person's condition might get worse unless you take action right then and now. And symptoms of heat-related emergencies also increase if they are left untreated. And this is where we can get into heat exhaustion. Heat exhaustion is a serious condition that often turns into heat stroke, and it occurs when someone exercises in the heat and sweats a lot. So what are the signs of heat exhaustion? There's sweating again, but we have more intense symptoms, which include nausea, dizziness, vomiting, muscle cramps, feeling faint, and fatigue. So how do you treat this? Make sure the scene is safe, phone 911, have the person lie down in a cool space, and remove as much of the person's clothing as possible. Cool them down with a cool water spray, and if that's not available, put cool damp cloths in their neck, armpit, and groin area, and again, have them to drink something that contains sugar or electrolytes. Here's heat stroke. So this is a very serious condition. It looks similar to heat exhaustion, but it is life-threatening, and you need to act quickly. So what are the signs of heat stroke? So the key signs include confusion, passing out, dizziness, seizures, but other signs are also, again, nausea, vomiting, muscle cramps, feeling faint, and fatigue. So how do you treat heat stroke? Make sure scene is safe, phone 911, put the person in cool water up to their neck if there's possible, and if they need CPR, give CPR. So again, we're gonna read over the steps again. Begin cooling the person immediately, as every minute counts. And if you can't put them into cool water up to their neck, cool them with a cool water spray. And stop cooling the person once their behavior is normal again. And as continued cooling could lead into low body temperature, which is hypothermia, which is a cold-related emergency. Only put the water on the person's skin, and if they can drink, give them something with sugar, as sports drink are also the best. If they can't drink, wait for someone with more advanced training to arrive and take over. Now we go into cold-related emergencies. We're going to start with frostbite, which is a cold emergency, which affects the part of the body which are exposed to the cold, such as fingers, toes, nose, and ears. And it typically occurs in cold weather, but it can also occur inside if workers don't have gloves on and if they can't handle the cold materials, such as gases under pressure. What are the signs of frostbite? Signs include that the area is white, waxy, or grayish yellow. The area is cold and numb, and if the area is hard and the skin doesn't move when you push it. So how do you treat frostbite? Move the person to a warm place, call 911, remove any tight clothing or jewelry from the frostbitten part, remove wet clothing and pat the body dry, put dry clothes on the person and cover the person with a blanket, and do not try to thaw the frozen part if you think there may be a chance of refreezing. If you need to touch the frostbitten area, do so gently, as rubbing it may cause damage. Hypothermia. Hypothermia occurs when the body temperature falls. It's a serious condition which can cause death, and a person can develop hypothermia even when the temperature is above freezing. Shivering protects the body by producing heat. Shivering stops when the body becomes very cold. What are signs of frostbite? What are signs of hypothermia? The skin is cool to the touch, they're shivering, the person might be confused, drowsy, and their personality might change. How do we treat hypothermia? Get them out of the cold, remove wet clothing, and pat the body dry. Put dry clothes on the person and cover them with a blanket. Call 911 and wrap the person with anything you might have, clothing, towels, newspapers, and cover the head but not the face. And if the person needs CPR, give them CPR. Now, poison emergencies. A poison is anything that someone swallows, breathes, or gets in the eye or on the skin that causes sickness or death, and many products can poison people. If you think someone may have been exposed to a poison, make sure the scene is safe before giving first aid. This takes a few more steps than in other first aid situations. So make sure the scene is safe before you approach. If it's not safe, do not approach and tell everyone to move away. Look for signs that warn you that poisons are nearby. Look for spilled or leaking containers. Stay out of the area with the poison if you see more than one victim. If you approach the scene, wear appropriate protective equipment. Now, removing poisons. Get the poison off the person as quickly as you can and use lots of water to rinse the poisons off. So here are the actions and steps for removing poison. First of all, make sure the scene is safe. Get the first aid kit, wear PPE. Help the person take off contaminated clothing and jewelry. Quickly help the person find a safety shower or eye wash station. Brush off any dry powder or solid substances from the skin with your gloved hand, and rinse the contaminated area with lots of water for at least 20 minutes or until someone with more training arrives and takes over. Here is a picture. Now, if poison gets into your eye and only one eye is affected, make sure the eye with the poison in it is a lower eye as you rinse, so you can tilt your head towards the water as you rinse it out. Now, other first aid for poison emergencies. Make sure the scene is safe, get first aid kit, wear PPE, call 911, tell the dispatcher the name of the poison if it's possible, remove the poison if it's possible, move the person from the scene of the poison if you can, help the person move to an area with fresh air if it's possible, and send someone to get the material safety data sheet if it's available, so the MSDS sheet. Poison emergency. If you give CPR to a poison victim, make sure to use a mask when giving breaths if it's possible, and this precaution is especially important if the poison is on their lips or their mouth, so some dispatchers might connect you to a poison control center. Give only these antidotes that the poison control center or dispatcher tells you to, and first aid instructions on the poison itself can be helpful but might be incomplete. When you call the emergency response number, try to have the following information ready. What is the name of the poison? Can you describe it if you cannot name it? How much poison did the person touch, breathe, or swallow? How old is the person? What is their approximate weight? When did the poisoning happen? And how is the person feeling or acting right now? Here are some symbols related to poison and review. Heat stroke is a life-threatening condition. True or false? True. It's a very life-threatening. Being confused may be a symptom of heat stroke and low body temperature. True again, as a change in personality. If you give CPR to someone who has been poisoned, it is important to use a mask if possible to give breaths. True or false? True, as you do not want to get contaminated. And that's our last question for the day. Thank you for coming for today's lesson.